Alrighty. What is the difference between brushing your teeth with a toothbrush that has thicker bristles and one that has thinner bristles? And which is better?
Okay. So what are the different kind of toothbrushes that we have available to brush our teeth? Rather than saying thicker versus thinner bristles, I think the most common question that I get asked in my office is, hey, whether it is easier to use as a harder toothbrush or a softer toothbrush or a medium toothbrush. So if you, when you go to the store again next time, so just walk down the aisle and then just look at the different type of brushes that you have available. So most of them are going to be labeled as either hard ones or medium ones or the soft ones. So depending on whether they are hard or soft or medium, then that's what this person is referring to. They're going to be either thicker bristles or thinner bristles or tinier bristles, right? So again, it depends on, my recommendation is if you're going to use, my recommendation is to use a medium one, because if you are going to use a really thin one, which is a softer toothbrush, then you're not going to be brushing it good enough, then you're not going to be able to remove the plaque. If you're going to be using a really hard one, then if you don't know how to brush your teeth thoroughly or properly, then you may end up scrubbing your teeth and your gums very heavily. Then you may end up causing some damage to your gums, which means gum receding. Also, you may end up doing some damage to your teeth by heavily brushing them. You may end up causing some erosion or some abrasion to your teeth. So I don't recommend using the hard one either. So if you're going to use a medium one, it's just kind of like not too soft, not too hard. So that really helps. So that's what my recommendation would be. Again, there is no such thing as one size fits all. So for example, when my patients, when they have any type of oral surgical procedure or gum surgical procedures done in my office, and as you know, we administer or we dispense the really soft toothbrush. So as soon as after the surgical procedure, you don't want to be using either a medium or a hard toothbrush. You want to be using a softer toothbrush, and not first week after the procedure, because we don't recommend even brushing their teeth at all for like a week as soon as after the procedure. After the first week or 10 days, when they come to our office and we tell them to use a really soft toothbrush, that way they're not aggressively brushing their teeth and pulling the gum tissue away or pulling the stitches away. So that's the situation. We recommend they use a really soft toothbrush. And then harder toothbrush, I very hardly recommend using a softer toothbrush. Again, going back to the question that one of the other readers had earlier, well, if you're using your toothbrush properly, like the timer that we talked about earlier, if you're doing it for 2 minutes, there is absolutely no reason why you should be using a really hard toothbrush. If you're using a medium brush effectively, and if you're using the timer effectively, I don't really see a problem keeping your teeth cleaner, and I really don't see a reason why you should be picking a harder toothbrush. And I would rather be a little conservative and using the medium toothbrush a little bit longer versus taking a risk of using a harder toothbrush. Now you're going to end up both damaging your gums, damaging your teeth. Does that make sense to you?
Yeah, that makes sense.
Right. Okay, cool. All right. Cool.
So really you want to focus on technique and length.
You are absolutely correct. Yeah. So again, that's a great answer. So going back to what you mentioned, so not just the time, right? So of course I want you guys to use the timer for 2 minutes, but the technique. So this is something that I do for my son almost every single night. So I have a timer for him in my bathroom for the 2-minute timer. So he brushes his teeth for 2 minutes and I stand in the bathroom with him. But when he's done with the brushing for 2 minutes, he still has a little bit of plaque in his front teeth. So what do? Hey buddy, so I want you to use a timer for 2 minutes, because he's pretty good in brushing most of the teeth except for the lower front. So what I do is I have him use the timer for 2 minutes, and he's not done until he finishes the 2 minutes, my daughter or my son. And then after he finishes the 2 minutes, and now I'm going to stand right in front of him and I'm going to tell him, hey, buddy, this is the part that you normally miss. So I want you to take the toothbrush and I want you to pull the lip out and I want you to go bottom up like that, or top down like this, or in a circular motion. So again, going back to the 2-minute timer, like you mentioned, the technique what matters the most, and you want to make sure that you're going to cover all the teeth, and you're also going to not miss any of the teeth. Make sure it's plaque free.
Yeah, because what's 2 minutes if you're doing it sloppily?
You are absolutely right, bud. Yes, sir.